Welcome to the University of Iowa College of Dentistry and Clinics. My name's Kobi, I'm a D3.
My name's Kaitlyn, I'm a D1.
We're just going to give you a quick tour of our various specialties and clinics that we have here at the University of Iowa.
And share our why Iowa. Alright, so now we're sitting in Gallaghers Hall, so this is where the majority of lectures and exams will be held for dental students.
Gallaghers Hall right now is all the way open, but normally it's 3 separate rooms that each hold 80 students, which would be the size of your class.
Alrighty, so welcome to the simulation clinic. Students will spend a lot of their D1 and D2 years here. So this room is set up into pods, and these pods each have their own unit for each student.
At your unit, you will develop the hand skills that you'll use for your first time you see patients, D1 year. The cool thing about the units is that we have new delivery units, and the delivery unit is electric with an electric handpiece, and that is just like the rest of the clinics in the college, so you're really prepared as you move through the sim clinic to get to see patients later in dental school. We're in the Operative Clinic. The Operative Department here at the University of Iowa is lucky because all of our faculty have advanced degrees in operative dentistry. This is really important because
all students are learning from the best, and not only is Operative House here, but also our preventative clinic. So right here is where students are going to be seeing their first patient at the end of their D1 year.
Operative dentistry and preventative dentistry work together to provide the students with cutting-edge technology to help them develop the skills that they'll need to treat patients after dental school and during dental school during the rest of their time here.
And for students who are interested in preventative and community dentistry, they can take additional coursework to earn a distinction track.
Welcome to the Pediatric Department. Here you'll see patients up to the age of 16 years old.
Starting your D3 year, you will have a rotation within this department to provide comprehensive care for these kiddos. This will also include your D4 year.
The Pediatric Department has a really active pediatric club that gets to engage with the community around the college and provide care to people in need. Every patient that comes into the College of Dentistry goes through the oral diagnosis department. Your D3 year, you will have a rotation in oral diagnosis where you will see every patient that comes through and figure out what care that they need and either send them to comprehensive care for the D4s or to the various departments around the building.
Alrighty, so right now we're standing in the hallway that houses our oral pathology department.
The oral pathology department really provides 3 services to the community. 1, they educate the students here in the dental school.
Also with research, whether that's within this dental college or receiving samples from around the world.
They also provide another important service by taking those samples and informing the patient if they have a condition that needs to get looked into or not. We're standing in the family dentistry waiting room. Family dentistry is a rotation that you'll go through your D4 year. It's a comprehensive care clinic where you will see patients start to finish all year long with the same pool of patients like you will have in your clinical practice.
This is great for these patients because there's also a pharmacy that's embedded within the college. So any medications that you prescribe as a student, those patients can then stop in and pick up on their way out. In addition, you'll take various pharmacology courses throughout your time as a dental student, and those pharmacists are teaching those courses.
We're here in the Radiology Clinic. This is one of our pantograph machines that we have in the building. We also have access to a cone beam CT machine. Having this department here at the college is fantastic because we are able to just grab your patient really quick if you need to take an x-ray, bring them into the department, and the fantastic techs can help you if you have issues getting a good quality image. The other thing is that we'll start exposure to radiographs D2 year, and by the time you make it out of school, you will have taken so many radiographs that you are so prepared to not just take them, to also interpret the radiographs for your clinical practice.
Alright, and as you can see where we're standing right below the orthodontic entrance here at the University of Iowa, we do offer a top-tier world-renowned residency program for orthodontic residents.
In addition, all of your orthodontic coursework will be taught by orthodontists, and you'll have access to the faculty and residents for collaborative care as you develop the skills that you'll use for orthodontic care as a dentist.
So right now I'm standing underneath the Geriatric and Special Needs Clinic. So with an aging population, students are provided with experience and exposure to an underserved population. In addition, there are geriatric mobile dental units which travel surrounding nursing homes to represent these underserved populations that may not be able to come into the clinics.
Here we are in front of the endodontic clinic. The endodontic department here at the University of Iowa provides the students with a great education on a very important part of dentistry. I just finished my D2 rotation in endodontics, and I learned so much in the sim clinic that I feel very well prepared to see clinical patients here coming forward. We're standing outside the Perio and Pros clinics. Perio is a undertreated and underdiagnosed condition in the United States, and having the department here at the college will really help you better serve your patients as a clinician down the road, and will also make it so you are better able to serve your patients now while you're in dental school. We also have here the Pros department, and in Pros you'll do everything from prepping your first teeth for a crown to making a denture or a bridge. Another really cool thing that they're doing in the Pros clinic is they are making really big advances in digital dentistry. So you'll do scans of your dentures that you make or the crown that you're going to prep and mill them in the clinic, and that's fantastic to have access to the next generation of digital dentistry that you'll use as a clinician now in dental school.
Okay. Right now I'm standing in a surgical operatory room in the oral surgery department. So you'll have your first look in oral surgery your first year as a D1 as you give anesthesia to your fellow classmates. This will progress further your D2, D3, and D4 year as you move on to extractions and other procedures. Well, before we head into our next clinic, why don't we share some of our favorite parts about Iowa?
So I'm going into my D3 year, and what I appreciated my D1 through D3 years is that I didn't have to find patients. That's provided to us by the college, and that really allowed me to focus on my studies. Another cool thing is that at some schools, I didn't realize it when I went into school, but you have to find teeth, natural teeth to work on. That's all taken care of by the administration here at Iowa, so you don't have to do any of that stuff either.
And one thing I want to point out is that we offer all specialty areas here, which is really exciting.
Another thing that we have at the school that I think is pretty unique is that we have an embedded therapist. Her name's Carrie, and she is incredible, and she will make it easier for you on those times when you feel a little stressed during finals. She has ways to help you cope and study strategies that are really, really helpful.
And one thing I didn't take into account when I was looking at schools, but one thing I noticed right away at Iowa is all the natural light. And whether that's study spaces throughout the college or just walking through on the link here, there's a ton of natural light throughout the building. All right, and for my students interested in research,
the University of Iowa has a really great research program here at the college. You can start your D1 year if you want to.
Your D4 year.
You can do as much research or as little research as you want to. It's really up to you, and they make it very approachable and easy for you to do it on top of your course load starting D1 year.
And you don't have to have any experience in your undergraduate career to do research right when you get to dental school.
Let them know if you want to do it.
Sure.
Thank you for joining our virtual tour today.
We hope to see you soon.